Welcome back. The International Council of Nurses says health workers, including nurses, must be a top priority for a future COVID-19 vaccine. The council says nurses are often left without enough protection against the virus in their frontline jobs. Figures from the council shows that an estimated 1.5 million health workers have contracted the novel coronavirus, and this is 3 times more than the figure from early June.
Chief Executive for the Geneva-based International Council of Nurses, Howard Catton, says the continuous rising numbers in the healthcare sector is a serious cause for concern.
To be frank, many governments have just been too slow to prioritise nurses and healthcare workers. So we're saying when it comes to vaccines, no excuses, no ifs, no buts. We're putting governments on notice now that nurses and healthcare workers must be prioritised for a vaccine when it becomes available.
Catton says the ICN is particularly concerned about the situation in Africa and in the Americas.
Africa is a real area of concern. We're also concerned about the Americas. We've had to now write a number of letters to presidents of countries about the concerns that we have for nurses and for health care workers. We need to do much, much more to prioritise their protection, and when a vaccine is available, to say now that we will commit to prioritising them for vaccination as soon as we have a vaccine.
The WHO's top emergency expert, Dr. Mike Ryan, said last week that researchers are making good progress in developing vaccines against COVID-19, with only a handful in late-stage trials. But he cautioned that their first use cannot be expected until early 2021.
The numbers of infections continues to rise around the world. We've just gone through the 15 million barrier. We've estimated around 8% of those are healthcare workers. WHO have said it could be up to 10%. That's 1.5 million nurses and health workers who are likely to be infected by the virus. And if they have to go off sick, on top of shortages, on top of the burnout and the exhaustion we see as well, we are just going to have huge gaps in our health systems.
WHO says the organization is already working on a framework to ensure fair and equitable access of COVID-19 vaccines. The organization says 3 groups that will be prioritized include frontline workers such as medics and the police, vulnerable people over 65, and those at higher risk due to illness, and those in higher transmission settings such as meat factories, prisons or care homes.
Charles, thank you very much indeed for that report. Let's get more on the story. The International Council of Nurses is calling for government to acknowledge the role of nurses and other healthcare workers. Let me bring in the I.C.N CEO Howard Catton via Skype. Howard, a very good morning to you.
Good morning to you.
So what has the I.C.N observed that pushes you to force government's hand in prioritizing healthcare workers?
We still continue to receive reports from right away around the world, 130 national nursing associations who are in membership of ICN, who tell us that there are still problems with the supply of PPE. And in Africa, we've also heard it can be about the quality of PPE, reports of fake PPE. So it's about having enough, but having the kit which is of the right quality. Issues with testing, lack of availability of testing for staff as well. Huge psychological mental health pressures that nurses are working under. We're 6 months down the road of this virus, and nurses and health workers have been working under huge stress and strain during that period of time. But as you heard in the piece, we feel that, frankly, many governments, far too many governments, have been slow to prioritise the protection of nurses and health workers. And that's why we're saying when a vaccine becomes available, we all hope that that's soon, but when we have a safe and effective vaccine, we're putting governments on notice. We are saying very clearly, you must absolutely prioritise nurses and healthcare workers, because that's, we believe, morally, ethically the right thing to do to protect the vulnerable, those who are at higher risk, and those who are looking after the most vulnerable. But also we think it makes sense for health systems for the reasons that I said in the report, that we need to keep our health systems working. And one way you do that is to keep nurses and other health workers at work.
You know, you were talking about the mental health consequences of fighting this pandemic on the front line. What have you picked up in terms of how nurses are coping with this? I mean, is it a sense of, suppressing what they really feel, the hardships that they're going through and getting on with the job for the sake of humanity, for the sake of society? Or are they seeking mental health, professional help in order to cope with this?
Yeah. Look, nursing work it's tough and it's challenging normally, but the intensity of this pandemic has meant that people are working longer hours, back-to-back shifts. We've had reports of people who have been sleeping at their health care facility. They are then having to deal with patients and families who are obviously very, very anxious and concerned because there is no cure. People who are worried about whether they will die, more people who are dying. Nurses are used to care for people who are in the latter stages of their life, but more people are dying as a result of this. And nurses then also having to step in where families, friends, relatives, because of the virus, cannot come and be with their nearest and dearest. Nurses are providing that support, and then nurses have their own families who are worried about their health and safety. Kids asking their mums, their dads, do you have to go to work? Will you be safe? So this is a huge pressure and strain that nurses are dealing with. And what we are saying is that we need to make sure that they're getting help and support. And it will vary for different people. For some people, it's about having some time out. It's about being able to talk, to be able to say, I'm not okay. But there are other people who will need professional help and support. We need to make sure that's available.
We don't realize the ripple effect that this pandemic causes, isn't it? It's not only the person on the front line, but it's their kids, their spouses, their parents as well. They take this home with them. So that needs to be recognized as well. The ICN has also called for this vaccine to be available to healthcare workers first upon discovery. Do you expect any pushback regarding this?
Look, I think it makes absolute sense in terms of our obligation, our responsibility to nurses and healthcare workers. But I also think it makes sense in relation to our health systems. One of the other ripple effects, it's not just our health systems coping with coronavirus. There's all of the other illnesses and ailments that people are getting through this pandemic, cancers, heart attacks, strokes. There is all of that healthcare demand that we still need to provide care for. And that's another reason why keeping our nurses, our health workers at work is so important to all of us. Of course, a vaccine has to be safe and effective before it's available to everybody. But look, if people want to argue with us about nurses being prioritised, I'm happy to have that discussion. But I think it's just such a straightforward, common sense move that we're calling on governments to commit to that. But we are saying it because, as I said, I think they've been slow on a number of other issues over the last 6 or 7 months. And the ICN is committed to do all we can for that not to be the case when it comes to a vaccine, because it will be competitive. We know around the world, the exit strategy is a vaccine. Everybody will be after it. And
they're working at such a breakneck speed, isn't it, in terms of developing this vaccine? When we talk about a vaccine, if you liken it to how to learn how to ride a bike, success will be to be able to ride that bike to the end of the street and not tip over, isn't it? What we know for now is that we can get onto the bike seat. Are you confident that we can get a safe vaccine by the end of the year or even early next year?
The $64 million question. But I think you're right to highlight that there are a lot of known unknowns. Will a vaccine? Will it limit the severity of the disease. It might not provide a cure, but it might be important in limiting the severity. How long will it last? How long will an immunity last? Will it be just a few months, or will it be longer than that? We hear reports that there could be vaccines because there's a lot in trial. There's positive news. It could be next year, but this might be it might be another 2 years. We don't know for sure. I think what this reinforces for all of us, though, is the importance of to keep following the basic but the so important public health advice that we're getting. Socially distance, wash your hands, use masks, follow the advice that's being given in your country, behave as though you believe that you have the virus. That's the best way to protect other people, but you're also protecting your health systems as well. Honestly, I think that we probably need a bit of a change in mindset to get used to the way that we have to live our lives now, continuing for another 2 years, possibly. But so important that we as the public follow that advice, don't get complacent, because I think we're still nearer the beginning than we are the end of this pandemic.
You have such an interesting dynamic here, because you have one section of the population that is desperate. I'm talking about world population, desperate for a vaccine, but you have a few people that are very apprehensive with regards to the vaccine because it's being worked at such a pace, warp speed, some are calling it. There's a section of society in America that say they might not take the vaccine when it comes. They're scared of what the safety effects of it. Do you think that will be a problem here in Africa?
I think you make an important point. We absolutely need to be sure that the vaccines that come forward are safe and effective. And obviously, we're not rolling out vaccines until that we're assured that they've been through the processes, they've been through the trials, so that we know that as sure as we can be that they are safe and effective. Yes, I think we will hear voices of people who will sow doubt about whether they are safe or what the consequences or what the side effects would be. But look, if we just look at what's happened with where people haven't taken vaccines, where they are available elsewhere, with measles, for example, the devastating effects that has on people who do get it. And one thing we know for sure, this virus is really effective. It's fast and swift to move. So yes, it needs to be safe and effective, but my view is that we then need to take the vaccine to protect everybody.
Howard, you got to go, but thank you very much indeed for your time, your perspective. Be well.
Thank you.
All right, that was the I.C.N CEO Howard Catton there. I want to take you now to Tanzania. The funeral service of the former president, Benjamin Mkapa, is taking place tomorrow. But today we're expecting national leaders as well as religious leaders to pay their respects to the late former president. Let's bring in our correspondent there, Daniel.